What's going on, everyone? Merry Christmas. Hopefully everyone is doing well, staying safe, healthy, and having a great holiday so far. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID, flu, or any other virus from one of these tests, I hope you have a full and speedy recovery. And if you're sick in general with something that's not positive on a test, I hope you have a full and speedy recovery from that as well. It is time now for the Christmas Day edition of the Virus Update for Christmas, December 25th, 2024. If you're new to my channel, welcome to my channel. Chances are you have clicked onto this video because you are sick right now. Yes, a lot of people have been turning to my videos lately. There's been a major increase in views because people being sick right now. I'm seeing it in the comments. And I asked you yesterday to give me 200 like button hits. You guys really did it. You did better than that. You did, I think it's 219 last I saw, or something like that. So thank you so much. If you're new here, you clicked onto the channel that updates you on all the viruses that can make us sick. There's a lot of them out there. There's a ton of people sick right now. Everywhere I go, I'm seeing people sick. I even have a family member that's sick right now from travel. Luckily, I did go out to CVS this morning. Yes, CVS was open today. And I had to pick up one of those COVID, flu A, flu B combo tests. They are negative for that. It's my mom. She's negative for it right now, so that is good. But, you still wonder, even with tests, you don't know how accurate they are, and you don't know if it's something else. Biggest symptom seems to be coughing. And yes, in case you're wondering, in the rest of the house, I am masking on Christmas. Anywho, we update you here on all the viruses that can make you sick. So if you're new, subscribe down below. Let's try for another 200 like button hits. Maybe hard to do that today. If we can get north of 150, it is Christmas Day. I would be very happy with that as well. Of course, share these videos with anyone you know. Subscribe, leave your comments down below. Hit that notification bell. Alrighty. Would you believe it? Yes, you're going to be very surprised about this. We said yesterday we didn't know if we were doing an update today because I didn't know how busy it would be. Well, guess what? There are a ton of news stories. Not a lot of data. We'll look at some wastewater data, but there are a ton of news stories today. Yes, on Christmas Day. I found a ton of things last night, and I found a couple additions just before starting this video, with the first one being a positive for COVID announcement. Armenia's Prime Minister Nikol Pashinyan has tested positive for COVID. It says again, I believe what happened was he tested positive a few days ago, then negative, and now he's positive again, or something like that. It's a rather confusing situation. The point is, he is positive, or has COVID, and he is going to skip the upcoming CIS summit in Russia. So, yes, positive for COVID, Armenian Prime Minister. 20 big cats die from bird flu at Washington Wildlife Sanctuary. This is not a good thing. I'll be adding this to a thread on my site. I'm probably going to have to do 2 threads. I said before we're going to do the national thread for human cases. I think there's going to have to be some sort of a national thread or a combination thread just for animals as well. I don't know. I'm going to figure something out. And I'll be working on that later in the week, not today. Kentucky is seeing high levels of respiratory illness, and it is shown on the map here that they are seeing high illness levels. And it says, according to the U.S. Centers for Disease Control and Prevention, Kentucky joins New Hampshire and Louisiana at having a high level of acute respiratory illness. After Christmas today and New Year's, probably these next couple of weeks, we'll see several more states join before hopefully a peak at some point in January. And they are saying here that cold, flu, influenza, RSV, all things that are spreading, and they are seeing more in their hospitals in Kentucky. All right, did you hear about this? This did make the news yesterday. I think it's important I share this in case you did not see it. FDA raises recall alert to highest level on Costco eggs over risk of severe illness or death due to salmonella poisoning. Yeah, this is not good. A lot of people shop at Costco's. Raise your hand. Leave a comment down below. Do you shop at Costco's? Do you buy eggs at Costco's? We shop at Costco's. So, yeah, this is rather concerning. I don't know that we buy eggs there. Very rare do we ever buy eggs there. Matter of fact, I can't recall last time we bought eggs there. Moving on to this. New York City, I told you, it's a busy day today. New York City actually posted this yesterday. We're getting to it today. RSV cases, not causes, RSV cases are currently high in New York City. To prevent the spread of RSV, flu, and COVID-19, New Yorkers, people everywhere, all around the world should do this, should mask up in crowded indoor settings, wash hands often, and stay home if sick. If you're 60 or older or pregnant, ask your provider about RSV vaccination. And yes, it looks like RSV vaccination is mainly for people who are older. I was actually doing some research on it myself. I was hoping I could get an RSV vaccination. Doesn't look like I can. I'm not old enough. If anyone knows otherwise, let me know down below. Because like I said, I do have a relative who has a severe case of RSV, or had a severe case. Haven't heard an update. And, yeah, but he was in the older bracket. He was over 70, so eventually I imagine he is now going to get a vaccination for RSV. Anywho, moving on to this now. Illinois Department of Public Health warns of a rise in seasonal illness ahead of holiday gatherings. This was posted just the other day, and it says here that they are dealing with a pretty big increase in people who are sick. It says, according to the department's seasonal respiratory illness dashboard, which we'll take a look at that another day, 15.1% of hospital admissions statewide and 14.7% of emergency department admissions were related to acute respiratory illness. 14.7%. Wow. And 15.1% of hospital admissions statewide. That is a really high number, considering all the other things that come to the hospital, strokes, heart attack, accidents, pain, hip fracture, all these different things that can happen. That is a pretty high percentage, and a percentage that will probably continue to go up for the next couple of weeks. So, yeah, not a good thing. They have a dashboard. Hey, we're going to be taking a look into that in the near future. Maybe tomorrow's update, because, again, it's going to be limited data over the next week. So anything I find, that is really considered a bonus. NIH-sponsored trial of nasal COVID-19 vaccine opens. Candidate vaccine could provide enhanced protection against emerging SARS-CoV-2 variants. So that is interesting. Moving on now to this. Award-winning show Titanic off Broadway has been canceled due to illness in the company. And we don't know what that illness is, but it's that time of year. Illnesses are continuously occurring. Things are getting canceled. And we got more Broadway news. I said it's a very busy news day. Gypsy cancels Christmas Day performance due to illness in the company. Due to continued illness within the company, tonight's performance is canceled. It's really risky to be going to these high crowd settings within an indoor place. Sometimes there's high ceilings, sometimes it's low ceilings. You get a large number of people together at this time of year. When so many people are sick, there is bound to be a recipe for disaster. Respiratory illness on the rise this winter. This time, it is in Georgia, in the Atlanta area. The number of people who are seeking out doctors for respiratory illnesses is increasing in Georgia. Some people are taking precautions before attending family gatherings around the holidays. And it looks like influenza, RSV, and COVID are prevalent in Georgia at this time. So that is not a good thing. There are a lot of viruses that are prevalent right now, and it's increasing in many places, and pretty soon, even the West Coast will have somewhat of an increase in COVID. It's not going to be a major increase out there because they got hit really hard in summertime. But trust me, there will be some sort of an increase out there. All right, just a reminder, my website is datareport.info. You can check out things there. We did post the news stories thread from yesterday. There will be one for today as well. We just went through a lot of things, and we went through it rather quick. Do you want to read the full articles that I'm reading headlines off of or tidbits out of? Well, you can do that when I make these threads. It gives you links to all the news stories, and I'll probably post that tonight at some point. Not right now. It's Christmas Day. I got things to do later on. And, yeah, you can do research on my website. COVID's effect on the brain, heart, lungs, long COVID studies. As I have been saying, over the next week, I'm going to be working to add more studies, like COVID's linked to diabetes. I'm going to look and see if there's more. we're going to get some of these up into double-digit numbers because you need answers for what's going on. You need studies to help you do research. Maybe you're having post-COVID symptoms. You can find that in my archive of links to studies. Taking a look at Canada, the viral activity level for COVID-19 is moderate. Flu A is moderate. Flu B is low. And RSV is high at this time. No update from the UK today. I don't think we'll get it tomorrow. We'll just have to see. Boxing Day, I believe that's tomorrow. Someone correct me on that if I'm wrong. Pretty sure that's the day after Christmas. Taking a look at what is going on with purple air, and you're going to see an alarming looking map here, and rightfully so. And I've been getting some people saying, hey, the air quality is oh so bad. Well, there's a reason for that. Christmas Eve and Christmas Day, historically, is a time where people light the fireplace. You know, Yule log, the log on the fire, a lot of songs that include chestnuts roasting over the fire, a lot of different things about fireplaces. Well, it's true. More people do use fireplaces during the Christmas holiday. The West Coast, look at the Great Lakes and the East, maybe some places in the South have fireplaces. Yeah, it's leading to increased smoke in the air, and it's going to take a weather system in order to clear that out. And check this out. I Googled it. We got our AI response, but, you need to see this. Yes, there's a question I put. Do more fireplaces burn on Christmas Day? Yes, more fireplaces are burned on Christmas Day than on other days of the year. On Christmas Day, there are twice as many house fires caused by open flames as on average days. Yeah, please be very careful with those fires. Make sure you're putting a screen to protect your fireplace, and make sure the embers aren't popping out. Don't have a fire next to a Christmas tree with lights on. That's not good either. And make sure the gifts are not near the tree if you haven't unwrapped the presents yet. All right, there is another place where I talk about climate and weather. That is Climate Data Report. Don't think I'm going to get to that video there today. Just simply don't have time to do both channels today. After all, it is Christmas Day. Good news out of Philadelphia yesterday. 712 EMS incidents were reported. That is actually a rather low number. So I'm happy to report that. Not happy to report about this. First off, Montgomery County is not terribly busy right now. That I'm happy to report on. What I'm not happy to... Actually, correction. This just refreshed. It's busier than it just looked a few seconds ago. We do have respiratory emergency. Not once, not twice. 3 times. Cardiac emergency. Someone choking as well. Cardiac arrest is showing up. Stroke is showing up. Yeah, it's not good, but I'm not happy to report that. Chester County, nothing. We can't report on Chester County. 500 internal server error. It's a holiday. They're not fixing that today. And sometimes it's just, I need to restart the browser. That could be the issue. Other times, no, it is an issue on their end. But again, Montgomery County, yes, it's, wow. Yeah, it's starting to get busy there. And sometimes it's the type of calls. And even fever is showing up. Not a good thing. And this is also not a good thing either. There's quite a few hospitals in eastern Pennsylvania, not western. Again, look at all these gray hospitals. Those are hospitals that are not reporting. I wish we had every gray hospital X'd out and turned into a green or whatever color it should be, but we don't. There's a lot of hospitals in eastern Pennsylvania that are doing bad today. In Chester, Pennsylvania, we have trauma diversion. We are currently on trauma divert at the Crozier Chester Medical Center. Please redirect all trauma unless necessary. No, that's not what we want. And then we have another hospital just to the northeast of there, Upper Darby, STEMI diversion. A lot of different diversions, and some of them could be volume, some of them could be staffing issue. Take a look at this. Now, this has not updated since the 23rd, so we will not look at that. This has updated today. And take a look at this. Penn Medicine, Chester County Hospital. High patient volumes. Prolonged wait times. Yeah, that's in Westchester, Pennsylvania. That's not good. Up in the Lehigh Valley. Look at this. 1, 2, 3, 4, 5 hospitals in the Lehigh Valley section of Pennsylvania showing up with yellow. And I'm seeing emergency departments near capacity. Behavioral health diversion, that seems to always be a problem at, what was that hospital? At Lehigh Valley Hospital, Hecktown, Oaks. Yeah, that always seems to be a problem there, but you can see here, St. Luke's Warren campus. Yeah, it's very busy, and take a look at this. Once again, St. Luke's Monroe campus in Monroe County, it's the Poconos. Yet again, it is near capacity. This just seems to be a continuing problem. And this is a section of Pennsylvania where the population has gone upward. They probably need another hospital. I mean, take a look here. Between the Poconos and Lehigh Valley, there's nothing. Bangor has no hospital. Look at that. No hospitals. There should be another hospital in between there, but that's probably a big issue that cannot get worked on. Taking a look at what is going on nationally with the COVID positivity rate from Walgreens. Current week, 15.5%. The prior week was 15.2%. Difference of up 0.3%. Testing did go up, so anytime it goes up with a big increase in testing, that's kind of concerning. It's not a big positivity rate increase, but it does represent the fact that, hey, yes, it's a sign of the times. COVID is starting to go up once again, and that was 6,934 tests conducted this week. All right, I want to do several wastewater sites today. Then we'll do one thing from the CDC, and that will be it for today's video. First off, maybe your holiday travel took you up to Vermont. It is a thing. A lot of people do go up to Vermont during the holidays because skiing, and there's other places people go. Now, I wish I could show you some of these ski resort towns, like Stowe, Vermont's a big one, or Killington, Sugarbush, is that up there? There's a lot of different places up there. Sunday River, that's over in Maine. There's a lot of different places that I wish I could show you. I can't. I can show you Montpelier, Vermont, and we do see in Montpelier that at this time, COVID levels are medium. They're not rising at this point. RSV is running high, although we're not seeing a big rise for that at this wastewater site. Influenza A, Influenza B, and HMPV all low at this time. Norovirus is listed in the medium, and Mpox at this time is not much of an issue. Let's also take a look at what is going on in Burlington, Vermont, while we're at it, because I do believe I saw Essex Junction. Is that the early stages of starting to rise? Yes. Early stages of rising for COVID. RSV is low at this time. Influenza A is low. Influenza B is low. HMPV is low. And norovirus is coming in at high levels. No issues with the other viruses at this time. Let's continue our way further south. Let's go down to Bridgewater, New Jersey. And wait till you see this. COVID is not calculated. In other words, the level. But if you had to ask me, it looks like it's starting to trend towards high. It is on the rise. RSV really went up there. Wonky movement. That may be peaking. I hope it's peaking. We'll have to see if it corrects later in the week. That would be a high level. Influenza A not calculated. Normally, seeing pathogens 230, that would be listed at high. Influenza B not calculated, and it looks like it's low at this time, as is HMPV. And norovirus, if it was calculated, yeah, that would probably be a high level at this time. No hepatitis since about October 2nd. Continuing our way down to the south now, and a little bit further south, let's go down to Winston-Salem. And we can see here, COVID levels are low. This is in North Carolina. RSV level, that's rising somewhat. Influenza A is low, but rising. Influenza B is low. HMPV is low. Norovirus is coming in high at this time. Mpox is low. And everything else is not much of an issue at this time. Now let's go take a look at Harrison, Arkansas, because you gotta see this. I looked at this earlier. Take a look at the COVID level. Yeah, we're seeing levels all the way up near 2,000 pathogens, really high at this time, and I hope it's peaking. I hope it's getting ready to drop, but that is a really high level, and it seems like when things rise at this wastewater site, they really go up. Remember norovirus, when it had the big problem there? We'll look at that in just a second. RSV is low this time. Influenza A, Influenza B is low. HMPV is low. Oh, take a look at this. Wow, norovirus is just off the charts at this wastewater site. That, my friends, is not a good thing to see whatsoever. Continuing our way a little bit further west now, let's go to North Parker, Colorado, see what's going on there. The COVID levels, they're going up slightly. RSV going up slightly. Both are listed at high. Influenza A is, wow, really running high at this wastewater site. Influenza B and HMPV are low. That's good. Norovirus is really running high here as well. And everything else is low at this time. Going out to the west, just to one more stop. We're going to make a stop down in San Diego, California. Let's see what's going on there. COVID is low. RSV is low. Influenza A, not calculated. That would probably be close to medium. Influenza B, HMPV, low. Norovirus probably would come up at medium as well. And hepatitis A, there have been some detections of that. Alrighty, let's take a look at something from the CDC. And first off, COVID-19 epidemic trends. Growing, likely growing, seems to be the theme in a lot of places around the country. In the Great Lakes, the Northeast, the South, Southeast, look at this, almost all the states, with exceptions to Arkansas and Missouri, Mid-South, you're seeing growing there, and it's likely growing in the West. Some places are not changing. Nowhere in the United States is declining. Not Alaska, not Hawaii, not Arkansas, not Missouri, not Wisconsin, any of these places. And Missouri at this time is in the not estimated phase at this point. Alrighty, folks, that does it for the Christmas Day virus update. We'll have another virus update again tomorrow. I'm sure it'll probably be a busy one, although we'll see how many news stories come out this evening, given it's a holiday, but I'm sure tomorrow there will be news stories that come out. I will see you all again tomorrow. If you enjoyed this video, give it a thumbs up. Hit that notification bell, subscribe down below, leave your comments down below, share these videos with anyone you know, and of course, the most important thing about today, it's Christmas. Have a very Merry Christmas. Thanks for joining me on this Christmas Day. I will see you all again next time. Until I see you again next time, stay safe, everyone. Once again, Merry Christmas, Happy Holidays. Just enjoy this day and do it safely. Thanks for watching.